about the issue of period versus fertility. Can your period tell you anything about your fertility?
Yes, when I often have women that come to me with fertility issues, I ask about their period. I want to know their period. Number one, their cycles. So, like we said, you have about 28 to 32 days or so, give or take, between when you're bleeding.
Mm-hmm.
And so in the middle of that is when you ovulate. So the egg is released from your ovaries. You have 2 ovaries. You have 1 egg, sometimes 2 eggs, sometimes 3 eggs will be released. And so the whole point of that is so that it can meet with the sperm and then implant into the endometrium tissue, into that cervical tissue I talked about earlier. And so if you don't ovulate, then that's a problem. So I guess it's around day 12 to 16 is when you ovulate. So if you have irregular periods, it could be because you're not ovulating. And so that could just delay your period because your body doesn't know, like, okay, have I released that egg or have I not? Mm-hmm. So that leads to some infertility issues. And like I said earlier, if you have very, very short periods, like that 21 day, you're not allowing enough time for the lining of that endometrium to get thick. So imagine you need about 10 or more days for that lining to thicken. So if you ovulate at day 14 and 6 days later you start your period, that's not enough for the lining to thicken. Yeah. So in your case, you had 21 day periods. You probably ovulated earlier. So you probably ovulated maybe day 10 or day 11, which happens. It happens to a lot of women. They ovulate earlier. So the biggest thing here is making sure you have a regular period so that we know that you're ovulating. Some women will have a regular period and they'll kind of release an egg, but it's low quality. So you can have other issues that go down the line. We need to do further testing. But overall, if I see that a woman has a 30-day cycle, a 30-day period, and she doesn't have the blood clots, she doesn't have the painful periods, she doesn't have, she bleeds for 3 to 5 days, and it's not heavy, then I know, okay, her chances of getting pregnant are very, very high. And if she's not, I can't think of a single instance where I found a woman that is infertile that has the qualities, the list that I just talked about. So usually women that have fertility issues or that have delayed conception, usually they struggle with some of the things that I talked about today.
Okay, so is it possible then, if you don't have the things that you've just talked about, is it possible to actually be able to get your body into that space where you have optimal health for fertility? I mean, what should we do? What are the key steps?
Number one, food. Watch the food that you eat. So I say this, I emphasize food a lot because many people eat 3 or more times a day. So think about the different things that you put on your plate every day. And you're eating that food once, but then you're eating it again and again and again and again and again. So think about if a person has an allergy towards a mealy meal and they don't even know it, and they're eating mealy meal. Let's say you have porridge in the morning, and then let's say you have sada at night, every single day. Then that causes a devastating effect to you. Now, I'm not saying that a lot of people are allergic to mealy meal. And a lot of people are allergic to whatever. Each person is different. But food is something that we constantly consume all of the time. And I've been able to really work on people's fertility just by changing the foods that they eat. So I would say, number one, just eliminate a lot of eliminate sugar as a starting point. And eliminate a lot of the foods that I talk about I have lots of free resources, my YouTube channel, Dr. Vita Natural Health. I even have free guides that you can check out. So just start eliminating some of those foods that I talk about. And there are also some lifestyle things to eliminate. Of course, limit your consumption of alcohol. If you're trying to get pregnant, don't drink any alcohol at all. And of course, stay away from tobacco. Be careful about the things that you put on your body. The lotions and things that we use are very, very important because we absorb food through our skin. And so they're what are called endocrine disruptors. And so the endocrine system is our hormone system. And so they're endocrine disrupting chemicals that are in a lot of the mainstream lotions and makeups and things like that. So they come in and they tend to mess with the hormonal function and contribute to fertility issues. So I would say that if you want optimal fertility, even if you don't have fertility issues yet or you haven't started getting pregnant, I always tell women that ahead of time, make sure that you're consuming the proper foods for your body and that you're not putting anything on your skin that is harmful. That is a good starting point.
Yeah, I've actually seen your video that talks about the different chemicals that are in the environment that can affect our fertility. So that's on your Instagram and YouTube as well as the Facebook, right? Yes.
Yes. YouTube is always the best just because everything's organized in playlists. So you can go to the playlist for fertility, for example, and then you can kind of just browse through. There's more content on my YouTube than anywhere else.
Yeah.